I'll tell you one of the main things that I look forward to about it is we have issues. We have a hard time with follow up. So our team submits clinical and does those, and they perform those initial notifications for payers, but with admissions coming every single day, sometimes they have a hard time getting back to follow up on the ones that are still pending and just getting the information transferred over. I mean, I try to help them. I go through accounts that don't have an auth number yet, and I'll look them up on the websites, payer websites, and there's all these different portals, and it's really time intensive. I mean, I probably spend an hour a day just logging in and out of software. I would really believe that's true. So I work. We have a lot. It takes a lot of time just to see, okay, what was the decision, and get that information entered where it needs to go, and this process is going to help us with that because it's just going to automatically happen. For one of our biggest payers, I mean, that's invaluable. I mean, I understand why my team has difficulty following up. I mean, you can't have as many staff as you want, because if we did, we'd have one person per patient and they just sit there, and when they need something, they do it. Nobody's ever going to get that, and that's just the way the world works. So I think we're staffed well, but that's just going to be a challenge. And for one of our major payers to always have those responses from the payer come automatically back, and that number to go where it needs to go on the claim, so that if we just don't happen to get back to that patient before they leave, let's talk short stays, 1 to 2 days especially. I mean, those are supposed to automatically bill out in 3 days. And we may not get back by then. And to know that for that big chunk of patients, when they're approved, we won't have to, it's just going to really help us a lot and help us do better on the payers that we don't have that option with yet for follow-up. So that's a huge deal for us, honestly. Because good follow-up is so important, because payers just, they're not really great at letting you know decisions and getting them back to you in a timely manner. And even if they've made the decision, it may not be on their log for a few days just because of their staff being over, having a lot of patients, I'm sure, whatever the excuse is. But we have a lot of issues with that.